Hello everyone, welcome to part 6 of memory based questions. So, a 70-year-old male with chronic back pain worsening in the morning with anterior uveitis. So, these are the symptoms for ankylosing spondylitis. X-ray was normal, but the question was which of the following is the investigation of choice. So for ankylosing spondylitis, investigation of choice is MRI to be done of the sacroiliac joints. Men with shoulder pain during extension, on examination a tear in the long head of the triceps. So triceps, they ask the origin of the triceps. Triceps origin is infraglenoid tubercle. 60-year-old, next question is 60-year-old with increased head size, on examination increased ALP with normal calcium and bones were warm to touch. This is all symptoms are relating to Paget's disease of the bone. 25-year-old fracture left tibia, severe pain and worsening with dorsiflexion. Peripheral pulses are present but sensations are lost. This is indication of compartment syndrome. For that, immediate fasciotomy is definitely needed. This is the answer. So 7-year-old child with painless limb. So that X-ray was also given. Image-based question, but if they are mentioning painless limb, then it is developmental dysplasia of the hip. This is a no-brainer. Now knee replacement was done for the patient. After 7 days he came with dyspnea and tachycardia. So which of the following tests will be done to rule out pulmonary these are the symptoms of pulmonary embolism. That was not given. These are the symptoms that relates to pulmonary embolism, and the test which will be done is CT pulmoangiography. Again, now diabetic patient with COVID-19 dies in a hospital. Which type of surveillance is can be done? So in a hospital we can do a passive surveillance. The options were active, passive, sentinel and syndromic surveillance, but answer is passive surveillance. Now de facto method of census data collection is location and time at the time of enumeration. Options are one, this is the option, second place of birth, third is the place of employment. So answer is location and time at the time of enumeration. Then study compares mean HB, that is of two independent groups. So what statistical test will be used? Not a paired test. Unpaired test can be used, yes. ANOVA is used for 3 groups. Okay, so answer is not a chi-square test also. So unpaired test, T test is the answer. Now 3-year-old difficulty in walking with bowing legs, underweight, less sun exposure. So it will be covered under which government scheme? So national, there were 4 options, out of 2 were easily ruled. The confusing ones were the ICDS and National Nutritional Deficiency Control Program, NNDCP. This is not the answer. ICDS is the answer. Integrated Child Development Services is the answer. Now prevention of coronary artery disease. So recommended dietary cholesterol intake per day should be, it is 100 mg bar 1000 kilocalories. One option is this, and second option is 200 mg by 1000 kilocalories. The answer is 100 mg per 1000 kilocalories. Now measure degree of objective for and target achievement in a health program. How you will measure it? So it is by evaluation you can measure. Planning, no. Monitoring, no. So answer will be evaluation. Now community intervention. For community intervention to decrease sepsis, 20 PSCs standard care and 20 PSCs were given community based intervention. So what is this study design? It is not a cross-sectional or case control, not a cohort. It is a cluster randomized controlled trial. Now, time between infection and reaching to the maximum point of the infection, it is called generation time. Options are incubation time, communication period. No, this is not that. This is not correct. Generation time is correct from the time of infection till reaching the maximum period of infection. Now, this is the graph given, just the image based question. So, on a VQ graph, which point shows pulmonary embolism? So, point D, this shows the pulmonary embolism on a VQ chart, ventilation perfusion graph. Then, men tracking high altitude, most common acid base abnormality. So, options were metabolic acidosis, metabolic alkalosis, respiratory alkalosis, respiratory acidosis. So, if on a high altitude, respiratory alkalosis will be there. This is the correct answer. Now, child with neurodegenerative disease with cherry red spot on fundus and hexoaminidase A deficiency was C. So, answer is GM2 gangliosidosis, not Niemann-Pick's or GM1. This is GM2. Now, Katori method, and in a 7th month old, what is recommended? That is half equals to 1 Katori and 4 times a day. This is the correct answer. Mostly people got confused for 6 times a day, but that is wrong. 4 times a day is the recommended answer. Now, women with regular 28-day cycle, normal hormonal activity on 21 to 25th day. It is low estrogen, high progesterone, and low LH and FSH. Low LH and FSH. Now, a 38-week pregnant, 5 centimeter cervical dilatation, regular contractions, develop umbilical cord prolapse. So, management. Wait and observe, no, this is not. Vaginal packing and oxytocin, no. Vagus technique is used for that elevating the presenting part, fill the bladder, retrograde filling of the bladder, and then emergency LSCS is done. That is called Vagus technique. A woman with atonic PPH after vaginal delivery not responding to the initial management, then what is the next step? Compression sutures, nahi. Then no, should not be given devascularized surgery, no, and immediate hysterectomy, no. Bakri balloon tamponade will be tried as the next step. Now, women with fetal bradycardia and maternal tachycardia. So, what is the most appropriate immediate management? Emergency LSCS is not done. Wait and watch should not be done. Artificial rupture of membrane. This is the correct answer. Now, 65-year-old post-menopausal woman with painless vaginal bleeding, no history of hormone replacement. So, diagnosis is, painless vaginal bleeding at this age, they clearly represents to endometrial carcinoma. Now, shoulder dystocia, correct sequence of manures in a vaginal delivery. So, macrobuds followed by Rubens followed by Gaskins and Zavanelli's manures should be done. This is the proper correct sequence. How many arteries and veins in a healthy normal umbilical cord? So, 2 arteries and 1 vein is present in a normal umbilical cord. Most appropriate prophylaxis in postnatal women at the risk of DVT is low molecular weight heparin, not warfarin, not aspirin, and not clopidogrel. Now, women with breast tenderness, bilateral breast tenderness with linea nigra and bluish discoloration of cervix signifies what? It's a probable pregnancy, confirmatory pregnancy or menopause. So it is probable pregnancy. These what are the signs of Chadwick's signs? What above signs? They are Chadwick's signs. This signifies probable pregnancy. Thank you for watching. Stay tuned for more updates.